I just let everybody in. So we'll go ahead and get started. Madison, are there any announcements before we get started with the content?
I don't believe so, not today.
Okay, great. Hi, everybody. As you can tell, I'm not JC today. My name is Laci Cornelison, and I am the director for the Center on Aging and support the PEAK team. Some of you probably know me when I was working in the lead role for the PEAK program. So today I'm gonna share some information that JC wanted to pass along, and then talk a little bit about a national program that's going on right now that really ties into your work with PEAK, especially in the core area daily routines. And there's a resource that is developed through this that I want to talk about, and some of our homes here in Kansas are actually using. So if you're one of those homes using it on the call, I'd love for you to share some of your personal experience with it if you feel moved to do that. So JC wanted to wanted me to pass along that there is new training available through the Alzheimer's Association through Project Echo. You may have already heard about it, but it is a series that runs October 14th to November the 18th. And professionals in assisted livings, nursing homes, and life plan communities with or without specialized dementia services are kind of the target for this. And there's a certificate of completion provided once you complete the training. It's NAB approved for CEUs for administrators at no cost. So you can register for that. This is, the curriculum is around best practices in person-centered care for people living with dementia. It's self-paced, 3 hours of curriculum. So if you're looking for CEs or some specialized training for dementia, this is a great resource. These are some of the training topics that are included here on the right and are available all within the Alzheimer's Association website, or the information's here on the screen. Brecken will be sending out the PowerPoints afterwards. So if you are trying to frantically write this down, you'll also get it in another format as well. So I'll move on to talk a little bit about what I came to talk about today, which is the Moving Forward Nursing Home Quality Coalition. That's a national coalition. And their work is pretty broad and expansive, but I'm going to talk about their work with the Residents' Goals, Preferences, and Priorities Guide. So Moving Forward Coalition is a nationwide coalition of both individuals and organizations that work to improve nursing home quality, while creating relationships that are needed to sustain something like this over the long haul. So there's a lot of different synergies of people connecting from across the country doing similar work. So for instance, I was invited to participate in this. Well, let me back up just a minute. This work was a call to action from the NASEM report that came out in 2022. It's like a 400-page document that talks all about the different challenges and shortcomings of nursing homes from a research standpoint. That really is a call to action. How can we improve nursing homes? And so the coalition was formed and funded by the John A. Hartford Foundation to really not only, well, the challenges and problems were identified, but the coalition was formed to do something about it, to keep it off this shelf, make action actually happen. Sometimes these reports are written and then nothing happens. So after 2022, the coalition was formed, and because this document had so many different subjects identified, it was important to prioritize, because you can't effectively change or do everything. So really prioritizing what are things that we can do and make an impact with real change. And so some of the topic areas were health information technology, quality measurement and improvement, quality assurance, financing, transparency and accountability, workforce and person-centered care. And so a lot of different stakeholders were involved in these different groups, including residents. There was a whole group that was residents that shared their voice. And so then action plans were created. And I'm going to talk about the action plan related to person-centered care here in a bit. So I got invited to participate in this work primarily because Kansas has the PEAK program. And so people from across the country that are in that space of working with person-centered care, providers, advocates, researchers, educators, all different types of people were tapped who are doing similar type of work. And it always works better for something to have action associated with it if we can join forces to make that work advance. So that's how I got.
Put the phone over here and we can switch to the phone audio.
Okay, I was getting a little feedback, but I think it's gone now. So I started participating. Well, the one thing I'd say about the PEAK work is, I was at that table because the work that's been done in Kansas isn't staying just here in Kansas. It's really become something that people outside of our state are looking at, using our resources, and have found it really helpful. And so I think that is just a real testament to the work that you all have done in your participation in the program as well. So I started to participate with the person-centered care group and quickly was asked to take on a more leading role because of the experience, the tools, and the resources that are here in Kansas to really help other people understand them and how they work and how they can be valuable. So the group that I worked with partnered up with the health information technology group as well as the measurement group. And we created an action plan for addressing residents' goals, preferences, and priorities, or from here on out, I'm going to call them GPPs. It's really about what things matter to residents. That's kind of how we're framing it is, finding out, documenting, and supporting or helping people live out what matters most to them. So what we did in the first couple of years is develop a guidebook that's all about addressing residents' GPPs. In thinking about how do we, provide best practices and processes related to residents really being at the center of that care planning process. I don't know about you, but a lot of times when we think about the MDS and the care planning process, the MDS generates RAPs or problems that then lead us to what we need to care plan about. And sometimes that process unintentionally pushes us to this area where, this assessment tells us this about you clinically or what your problems are. Now we're going to create interventions around those things. But what we often don't do is put the resident at the center of that and say, what are your goals? Then looking at what the challenges are for that resident and then putting the interventions within the context of what that person wants. And so that's what this guidebook is really all about. It helps develop a process for staff to identify, document, and implement residents' goals. Through this process, the HIT group, which is Health Information Technology, developed an interview for evaluators to ask residents, care partners, direct care staff, and senior leaders about care concordance. What that means is, what are the residents' goals? What kind of care is being provided, and do they match or do they not? And that's something that will be continued work. And then the other piece was developing an outline for a digital tool that nursing home residents would be able to complete themselves with a care partner to share their goals. So that work is a bit ongoing. So I'm going to share a video that kind of introduces this guidebook a little more.
If you're watching this video, you most likely work in a nursing home. So, how can we provide the best possible quality of life for people living here? To build a positive relationship with each individual that starts with key principles, such as working to gain his or her trust. We know that residents have a lot going on related to their daily activities and care. Working in a nursing home is incredibly rewarding, but responding to each person's needs and requests can sometimes be challenging. Each of us is asked to work with individuals every day, supporting each person to do things like socialize with others, get to meals, take a walk outside. But our team's mission is more than just those activities. That's why getting a clear idea of what matters most to each resident is so important. And that is where we want to focus our time as much as possible. We want to encourage each resident living here to direct us as to how they want to live day to day as much as possible. Goal discussions should be part of our practice with every resident every day. This is part of our commitment to keeping each person's goals and wishes at the center of their daily life. Listen to one example of how acting on one's goals enhance the person's quality of life.
Miss Houston, is that what you prefer to be called?
I do not prefer to be called at all.
Well, what should I call you?
Merle.
Merle. Can I
Yeah.
call you Merle?
You may.
All right. What kind of things do you like to do throughout the day?
What do I like to do?
How do you like to spend your leisure time?
Well, having spent most of my life as a librarian, I like to read. And unfortunately for my friends, I like to make recommendations for what they would like to read, whether they know it or not.
Okay. About what time do you go to bed at night?
9 to 10.
The guide and process you will learn about, addressing residents' goals, preferences, and priorities, provides step-by-step guidance on how to establish an approach to identify, document, and implement each person's goals. While the guide and process will help get the team started, each staff member on the team will provide feedback and help to shape the process for individuals living in your community. Hearing and acting on each person's goals and wishes focuses everyone on promoting quality of life and keeps humanity at the center of everything that we do. Thank you very much for the work that you do every day. We look forward to working with you and your team.
So that video is really a primer so that people know that what this is and how to access it, how to use it. So we were really fortunate to have a partner as a part of the national group that basically donated their resources to be able to develop that video. So The guide development itself was a process of pretty high involvement from different groups of people. There was an advisory group that had different types of experts on it and providers. There was also, after the guide was developed, a provider feedback group that helped to share, important feedback about how feasible is this, what works well, what doesn't work well, what don't you understand, that kind of thing. And then we had a resident focus group, and I think this is what I'm most proud about, is that the resident focus group was asked ahead of making this guidebook, what are the things that are most important to you with your care, and what things have worked well for you and what things haven't worked well for you. And they ran through just a laundry list of different things around the care planning process, the move-in process, the daily care process, that helped us see where the pinch points were for, care not being really focused around the resident. And then we put the guidebook together and consulted this group periodically throughout. But at the end of it, that same resident focus group looked at the guidebook that was developed, and the feedback that our group got back was, you nailed it. You addressed all of the different things that we shared with you. And we feel heard and seen. And that was the greatest compliment for our group, was okay, if the residents are saying this is on target, then we've hit something. And so I feel really good about that piece of it. And then we did have cross-committee collaboration. And what's really important about that is these other different groups are helping integrate language into electronic charting types of systems that will allow person-centered care language to get into those systems. That has to happen through something called a links code. And if there is not a links code for it, it doesn't exist. And so we know that a lot of the language in electronic charting is very clinically focused. And so that group is helping work to integrate some person-centered language that's really been informed by older adults themselves into those systems. Then we also have people who develop majors from CMS or have background from CMS, helping to also think about measures that can be used that would fit alongside this process. And that will be down the road, but we're hoping to integrate some of this stuff nationally within CMS systems. So the process that you all know if you worked on the daily routines is kind of starting from that process of collecting resident information about what matters to them, documenting it, aligning it with their care, and then implementing it. Then you revisit it, right? Is this going well? Is there anything that's changed? And then keeping that loop going. And so that's what the guidebook is really all about. It's like a how-to manual for putting that resident voice in the center. It's got practical steps in it and tips and resources. The guidebook is available online and is downloadable or printable, either way. I'm just going to share a few examples that are in the guidebook. One is a orientation piece for residents and their families or advocates that you could include in a welcome packet. And these can be if you're downloading this as a PDF, you can copy the language that's used in here and modify it for your own purposes. So you can customize it for your building, for your organization, so it matches your care planning process. But it helps new people moving in to understand, what is a care plan? How does it work here? What can you expect? And there is one for short stay residents and for long stay residents. So if you have a rehab or somebody is there for a Medicare Part A stay and not planning to stay for a long time, the short stay would be appropriate. And then there's another one for the long stay. And then this is, Kansas is further ahead than a lot of other homes. So speaking to other peak participants, this is a very minimal preference sheet. Okay, so I'm sure that some of you have a much better one than this, but we had to kind of start with, if we were working with a highly clinical home, how could we get some really critical information on one page? And it was really pushing it with this national group to get much more personalized information on this sheet. So I'm going to preface this with that, but the idea is that you have like a mini care plan. This could be printed, it could be in the electronic record in, say, a Cardex. Many of you have a system like that. You can adapt it to a system, but it gives people an understanding of how you get information in that big care plan to the people who are working most closely with the resident. And again, that is directly related to the daily routines core. And this would be a resource, something that you could use. Some of you probably already using something like that. But in the guidebook are other things, many of which we got from, ideas of homes working directly in the PEAK program. So this guidebook was really kind of informed by the daily routines core. And one of the things that I wanted to tell you is this supporting practice 1 is that move-in assessment, gathering information about routines and preferences prior to move-in, getting caregivers access to that information, really trying to support those really key things, what matters most from that first day that they're there as much as possible. And this was a conversation on a national level, and it was a bit controversial, this idea of getting it prior to move-in, from the expert side, from even the provider side. But simultaneously, meaning parallel, not going to the residents afterwards and asking, but at the same time, unknowing about our conversation of the move-in assessment, residents said, you need to start learning about us before we even come there. And they said, it was from their feedback, that you need to start learning about who I am and what matters to me before I move in. And so it really just validates that need for getting information upfront as soon as you can and continuing to do that. So that was interesting. And after the resident feedback, the whole group was like, oh, okay, we're on board now. So so the guidebook has some reference to that as well in it to support that prior to move-in process, although not as robust as some of the things I know that many of you are doing, and that we specifically outline in the PEAK criteria. So what I think is that the reason JC wanted me to share this with you today is that the guidebook could help come alongside some of the aspects of your work with PEAK. Okay, hi Pioneer Manor. This is recorded, so I know you missed part of it, but you can go back and catch part of it later as well. So this has some specific objectives with it in terms of the PEAK criteria and required outcomes. The guidebook is a companion to kind of help come alongside your work in achieving or accomplishing these things. So we'll see if this works, because here we go. So this guidebook is available online. I've provided the link there, and you can download the PDF version. I'm just going to make it a little smaller. But it has the how-to portion of it, and then it has the tools and templates in it. But these are printable worksheets. So when you go to it, it has those different forms in it. You can print it, you can recreate them for yourselves. And just like the PEAK guidebook, it has this home button where you can go back to the table of contents to figure out which section that you want to go to or what page number something is on. Let me go back to the presentation, see if I can find it. Okay. Yeah. So while I'm getting back to my slide here, one of the things I want to do is talk a little bit about the pilot project with this. Where the guidebook is right now is 6 homes here in Kansas are actually testing the guidebook, along with some technical support from Addie Van Zutphen, who's been working individually with each of these teams to work their way through the guidebook. And part of the reason that this is a pilot is to get specific feedback about, what works well, what didn't work well, and how can we improve the guidebook. And a couple of the things right away this year we identified is that we need a self-audit type of tool, so that when you get into the guidebook, it has everything in it, as if you were starting from square one, right? That you weren't doing any of this. But we know that most places are doing at least some of this stuff. Maybe not all of it. Maybe you are doing all of it. So how do you know? How do you know where you are with the practices? And so the self-audit tool would do that. Addie is developing that. And then the other piece is action planning resources. And you all already have access to that with the daily routines core. If you're specifically working on that, but the teams Addie's been working on have found those 2 things to be extremely helpful for customizing the guidebook to work for them. So that's kind of where we're at. On the testing part, we will be using that feedback to update the guidebook, and then we'll be working with more homes next year. If your home is interested in being a part of the pilot next year, we would welcome your participation. We're also going to include homes from Nebraska and Missouri as well. We're looking for about 20 homes. So if you want to be a part of it, do get in touch with me. You can email the Peak email if you want to, and Brecken will forward it on to me. So I want to just verbally thank some of the homes participating. This is Good Samaritan, Valley Vista, and Wamego. And Alice Bonner is the director for the Moving Forward Coalition, and came to visit Kansas this summer and met with that team. And she was just so incredibly impressed by the work that was going on here, and just pleasantly surprised with kind of how far advanced Kansas is in some respects compared to the work nationally. So I'm proud to be a part of that. So I want to stop there and open it up for questions or discussion. If anybody's on this call that is one of the pilot homes, I would welcome you to share some of your experience with that if you'd like to share. I'm going to stop sharing. Or you can put your thoughts in the chat as well. Everyone's quiet today. I would also take this time, this is my first Lunch and Learn participation, but I know that best practices are always something that's great to share for other homes. So if you are currently, if you've passed the daily routines core, or if you have specific questions about the daily routines core and are looking for ideas, please pipe up. Lisa says Seneca is part of the group and have found great resources with the program. Thank you, Lisa. Addie has sure enjoyed working with Seneca. I think on daily routines, one of the pieces that a lot of homes have troubles wrapping their head around is direct caregivers making changes to the care plans. I would love to know if there's a home out there that has a specific challenge that you're facing, or that something that has worked really well for you. Love for you to share for the greater good. It's quiet, like crickets. Okay. Well, if nobody has questions or thoughts they want to share, I don't want to keep you tied up. Do you have anything else, Madison?
Nope, I don't think so, unless anybody has any questions peak related
Yeah.
right now.
Watching the chat, I think like, maybe we need to go everyone in meeting. Okay, Tanya says, I think the All About Me sheet helps our staff know about the resident, and I try to go to the hospital to fill it out prior to admission, and it seems to make the residents feel more at ease. Thank you for sharing that. Yeah, that's great. The All About Me sheet, one of the things that was really interesting on the national level, I will have to say, is I have seen some amazing tools to collect information prior, like some amazing tools. And it was very clear to me that is not the normal. So you should really pat yourselves on the back for leaning into that, because on the other side, listening to residents, a part of this, and the resident group was, fairly small. In one respect, the actual focus group was about 50 residents, but there was also a whole bunch of residents involved with the health information technology side, which was similar questions, similar subjects and things like that. And this is by far the most important thing to the residents when you listen to them, among other things, but this is a big one. Pioneer Manor says we've been using this for a while and has helped us a lot to learn more about our residents to make their living as if they were at their home. Yeah, great. What Dawson does is make an elder feel more welcome. Is I go to do an interview and we will get a welcome basket ready for them when they are admitted, their bed with their favorite drinks, food, and snacks. It has made a huge difference in the attitude at admission. Thank you for sharing that, Regina. That's an even more personalized touch, to have that special little touch on their bed with their favorite snack. I mean, that's neat. Thanks for sharing that. Does anybody else do something unique like that? haven't missed any chats, have I? Okay. I had the chat set wrong for a little bit, so I apologize if you chatted in and I missed it. Okay. Well, we'll wrap up then, and I just want to thank you all for participating. I'll stay on for a little bit while you're signing off. Oh, we got one more. At admission, when they come in, we welcome them with a flower and something of their liking as well. That's awesome. Very cool. When you really think about that day and how kind of traumatic and unsettling it is, having something that feels familiar or just where they feel that little bit of love, not just like you're here sort of thing, is such an understated important thing. Okay, I'm going to stay on for a little bit. So if you have something you'd rather talk to me directly about, stay on, but you're welcome to leave the meeting when you're ready. Thank you all.